straight to stay on feeder road.
how are you?
Hello.
Hey, Karen.
How are you?
Great.
Oh, look at that shine out of my eyes. Let's see if I can still see. Yeah, that didn't work. Now I can't read anything. Oh, well, it is what it is.
What's that mean?
There we go.
Oh, you can hear us. Oh.
Testing 1, 2. Can you hear me okay?
Yes.
Yes. Good evening.
Good evening.
Yes, good evening. How are you?
I think I'm going to have to move my very noisy parrot. He'll never talk to me when I'm here, but then when I get on the
So that's what that is.
that's the parrot. Yeah, it'll sound like a screaming kid in a minute. Good.
Good evening, y'all. Can you hear me? This is Adrienne Zertuche.
Yes.
Yes.
Good evening,
Good evening.
everyone. Thank you for joining us. Thank you for all of you that are already logged on. We're having a bunch of folks trying to join right at this moment, right at 6:30. So I am going to hold off on launching our program just for a couple of more minutes. So thank you for your patience. In the meantime, please try and remember to mute your microphone so that we can avoid any unnecessary background noise while our speakers are presenting, okay? But again, welcome, you're in the right place. We'll be starting in the next couple of minutes once we give a few more people the chance to log on.
I love that. That's great.
As long as those are parrots and not a canary in the coal mine.
Yeah, there you go.
There you go. At this time, she's over 50 years old. And
Oh, wow.
She'll probably try to run the meeting. So.
Again, thanks to everybody that's joined. We're going to give it just a couple of more minutes for a few more folks to log on, and we'll get started in just a moment. Thanks for being here. Okay, well, I think that there are still a few folks logging on, but seeing as we have a jam-packed agenda tonight, I'd like to go ahead and get started. So good evening, everyone. My name is Adrienne Zertuche, and I'm an obstetrician gynecologist in Atlanta. I am the Georgia OBGYN Society Legislative Chair, and I have the honor as serving as your moderator tonight. So welcome everyone to our first ever Patient-Centered Physicians Coalition of Georgia legislative webinar. I would like to thank all of you for joining us. And just as a brief housekeeping item, ask that each of you go ahead and please mute your microphones, but not yourselves. So in other words, please make sure that your microphone is off and that your Zoom app shows that you are muted so that we don't have any unnecessary background noise, including parrots, while our speaker is presenting. But please do not hesitate to use the chat box throughout the night to submit questions and comments. Our staff will be monitoring and we want to hear from you. So now that we've reviewed the ground rules, I would like to formally welcome all of you, all of my Patient-Centered Physician Coalition of Georgia colleagues to tonight's webinar. Can you believe that we have over 150 practicing physicians, resident trainees, medical students registered for tonight's event? What a showing in this crazy time. And yet I'd also like to take a moment and just reflect on how very different this meeting is from our preceding legislative days at the Capitol. Last year, on March 5th, more than 280 of us met in person at the Georgia Train Depot for what ultimately became one of the final advocacy events of the 2020 Georgia legislative session. Our speakers included the Commissioner of Public Health, Dr. Kathleen Toomey, and our Governor, Brian Kemp. We then adjourned as a group and walked en masse to the Capitol. Without masks and without using hand sanitizer. We elbowed other advocates out of the way at the ropes to finagle really a less than 6 foot space to meet with our legislators face to face and to share our patient stories. What a different world we live in now, and how drastically different tonight's session and our upcoming webinars will be. But fear not, we have an excellent presentation planned for this evening to help us reframe our advocacy efforts in the setting of this COVID-19 pandemic, and to help us lobby effectively in our new virtual world. First, however, before we learn the how of virtual advocacy, I want to remind us of the why. What are our legislative goals this year, and why are they worth lobbying for over this sometimes awkward modality that we call Zoom? So to review these vital details, I'm now going to rope in a few other key folks that are on with us tonight. As a reminder, while each of you were invited here by your individual professional associations to attend the event tonight, it's important to remember that each of us in each of our associations are part of a larger group called the Patient-Centered Physicians Coalition of Georgia. This coalition, which I think a lot of us affectionately refer to as PC squared, represents 5 professional organizations and over 10,000 physicians in Georgia. What a powerful team. So tonight we will hear from the physician leaders within each of the PC Squared's 5 professional organizations, as they each take 3 to 5 minutes to review their association's specific legislative priorities. Certainly there will be some overlap in their comments, but it will be valuable to hear from all the groups to be sure we are on the same page when we apply tonight's lessons to our upcoming virtual meetings with our state legislators. So without first up, I'd like to introduce is Dr. Tom Fawcett from the Georgia Academy of Family Physicians on. And if so, Dr. Fawcett, please tell us about your legislative priorities.
Thanks so much, Adrienne. Yeah, I'm Tom Fawcett, and for a lot of you I haven't met, I'm from Adel, Georgia. I'm a private practice there in family medicine, and it's my honor this year to serve as president of our Georgia Academy of Family Physicians. And so thank you for the time tonight. We've discussed these initiatives before, and I've voiced these concerns already, but again, to represent what the needs and the request from our academy as far as what we would like to advocate for this year, in addition to what our legislative group and committee will be working on. Really, it comes down to about 4 big initiatives. Number one, we would like to continue to advocate for initiatives that will support rural primary care, and that is increasing and supporting primary care physicians and roles in rural communities as one of our top advocacy concerns. Also, of course, with a lot of others, we'll probably here to continue to seek to for Medicare and Medicaid parity for primary care physicians and most of the most utilized of the E&M codes, for example, as well as opposing any expansion of scope by non-appropriately trained clinicians credentialed and supervised by the Georgia Composite Medical Board, including prescription of Schedule II drugs. And then also to support legislation that will ease the current burden of medical malpractice litigation, including expanding pre-litigation options. There are a lot of sub topics under these, and so we look to meet these head on, but that summarizes in probably, that was less than 3 minutes, hopefully, but what our goals are this year. So thank you so much for that time.
Great, thank you so much. Next up, I see Dr. Melinda Willingham representing the Georgia chapter of the American Academy of Pediatrics.
Good evening, everyone, and thank you so much, Dr. Zertuche. I hope everyone can hear me. I am a pediatrician in private practice here in the local metropolitan Atlanta area, and I'm excited to be here this evening to share with you some of the legislative priorities from the Georgia chapter of the American Academy of Pediatrics for this legislative session. So we are so proud to join our coalition colleagues in seeking an increase in Medicaid rates for some commonly used codes. As Medicaid covers almost 2/3 of all Georgia children from birth through the age of 18, it is vitally important to their health and the health of the entire community where they live. We're pleased and proud the coalition has made so many legislators aware of the critical role that Medicaid plays, particularly in rural Georgia, and not just for Medicaid patients, but for the entire healthcare system that serves that community. And as we all know, the pandemic has made this need more important than ever. Our second legislative priority that we have, we're very concerned about the mental health of our patients as the pandemic has added more stress in the lives of children. As pediatricians, we are seeing this in our practices every day. The difficulties of virtual learning, in some cases, disruption of normal routines, loss of socialization are some of the factors that have increased anxiety and depression in children and teens. And while services for mental health of children and adolescents have never been optimal in Georgia, the COVID-19 pandemic has strained them to a breaking point. We will be very supportive of budget items in any legislation that addresses and seeks to ameliorate these critical problems. Thirdly, obviously COVID vaccinations are on everyone's mind now, but as pediatricians, we are acutely aware of the importance of all of the other routine vaccinations for children, teens, and young adults. High immunization rates for these diseases need to be maintained during the pandemic. We will be watchful of any attempts to weaken our current immunization laws and strongly oppose them. And finally, we are investigating the cost of coverage for donor breast milk in the Georgia Medicaid program. Currently, it is not a covered service. This in spite of the fact that when given to premature infants, it can be tremendously helpful in reducing the incidence of necrotizing enterocolitis to these fragile newborns. It is a growing trend in state Medicaid programs, and we hope that Georgia will soon follow suit. So those are just a few of our legislative priorities that we wanted to share this evening for the 2021 state legislative session. Thank you.
Great, thank you, Dr. Willingham. Next up, Dr. Walden Garris, representing the Georgia chapter of the American College of Physicians. Dr. Garris.
Thank you, and good evening to everyone. We have 6 legislative priorities here. I would like to thank the members of our chapter. We have a very active health and public policy committee who helped craft this list. So first is to support legislation related to tobacco and vaping taxation to get Georgia up to the national average. And I'm sure we have other champions on this that would agree with us there. Secondly, to support legislation for the adequacy of insurance networks to assure that we have access to care for our patients. So things that would work against these narrow networks. Third, to support legislation to reduce the administrative burdens of prior authorizations, as these impact both our patients and the physicians and our wellness as we're struggling to do our work in this trying time. Fourth, to continue advocacy for the state to provide greater access to care with increased Medicaid coverage. And really two things here. One is to cover more people in the state with Medicaid. And secondly, to increase the funding so that there's parity Medicaid with Medicare reimbursements for physicians. Fifth, continue to monitor legislation to assure that patients have access to safe, patient-centered, high-quality care, just as was mentioned with our family medicine colleagues, advocating against allowing creep of scope for people to practice independently without physician supervision. And finally, to preserve the health and lives of Georgians, we support the equitable promulgation and distribution of education, safety measures, and treatment options, and preventive interventions relative to the COVID pandemic. That's our legislative priorities. Thank you.
Wonderful. Thank you, Dr. Garris. And then next, Dr. Karen Turner, representing the Georgia Osteopathic Medical Association. Dr. Turner.
All right, thank you, everybody. I'm Karen Turner. I'm family practice from Savannah, Georgia, and president of the Georgia Osteopathic Medical Association this year. And I am very proud to be a member of this coalition and to represent GOMA. We are here as our statewide organization. We represent all specialties of osteopathic medicine in Georgia. So I always like to be last because it's the easiest to say ditto to everybody who came before me, because that's what we are here for. But as in the country, osteopathic primary care specialties are over 50% of our population, not only in the state, but federally wise too. So our legislative priorities do overlap the priorities of that we've heard from the different specialty colleges already and to come after me. But our force provides extra manpower for working with the legislative to help all these organizations. And many of your organizations and many of the other organizations have osteopathic physicians in the organization that may be a member of GOMA too. So it just makes us stronger because we have a united voice. But our major priorities, which are cross-cutting through our specialties, are issues that impact, number one, the access of good quality care, including access for our patients for affordable medications. That would be number one. Number two, to support legislation that will ease the administrative burden that we all experience secondary to prior auths, as we've heard, and mindless performance of meaningless measures created through MIPS and MACRA to make our lives daily useless. I call it meaningless use. So I'm an advocate of that, and I have been for years. And number three, the scope of practice is important to us also for physician extenders for safe use and medication use, as mentioned before. And we, as a group, are monitoring the scope of practice of chiropractors who want to get into the practice of medicine without proper training. And we are going to be very heavily hitting on that. We are supporting GOMA, two bills that I'd like to bring up to you because they're very interesting. But the one bill is Bill 115, which is a bill to inhibit insurers from using information derived from genetic testing for any non-therapeutic purpose. I think in a day and an age where we're seeing politically the making of lists, we certainly don't want genetic lists. And I think that's important that we will watch that. And number two, I love this, and you'll end up with this from me, is that GOMA is supporting a bathroom bill, because the last couple years have all been about bathrooms. Who can use a bathroom, what kind of bathroom, what to name the bathrooms. And last year, it was all about bathroom toilet paper or lack of. So this year we have a bill, Bill 99, which is supporting a expansion of the ADA bill, which basically relates to handicapped persons being able to access employee toilets in retail establishments, no matter what their rules, for any condition relating to their disability. This was sponsored and created by the Crohn's Society and those with the irritable bowel syndrome. So with that, I leave that to you, and I would love to end with something on that nature. Thank you.
Great, thank you very much, Dr. Turner, and all of the other physician leaders for your updates. To wrap up this portion of the agenda, I'm going to briefly take off my moderator hat and speak for one moment as the Georgia OBGYN Society Legislative Chair. So again, like Dr. Turner said, I say ditto to much of what has already been covered, but just to highlight a few additional items. The Georgia OBGYN Society's top priority in 2021 is the ongoing fight to improve Georgia's maternal mortality, morbidity rates, and disparities. While we were certainly thrilled with the passage last year of House Bill 1114, which forged a path to extend comprehensive Medicaid coverage to 6 months postpartum, our ultimate goal remains to secure a full year of coverage, which is in accordance with the recommendations not only of our own Georgia Maternal Mortality Review Committee, but also our national organization, American College of OBGYNs. Another strategy we hope that will make a difference in maternal outcomes is, again, to encourage our elected officials regarding Medicaid reimbursement rates, as has been mentioned previously. Higher payments can certainly help all OBGYNs to continue providing obstetric services to low-income women, but they are particularly useful to OBGYNs in rural areas, which otherwise struggle to keep their doors open in the setting of distorted payer mixes. And we all know about the obstetric care crisis in our state in rural areas. Furthermore, we're hoping for some legislative support to improve compliance with our maternal mortality review record requests. Streamlining this process will only help our abstractors and our maternal mortality review committee to make more meaningful conclusions and in a more efficient manner. And finally, we at the Georgia OBGYN Society remain committed to protecting physicians in the state by backing any tort reform legislation that's introduced. Well, everyone, we made it. It is finally time for our headline event. We are fortunate tonight to have Brian Robinson with us from Robinson Republic, a consulting firm specializing in public affairs. Prior to launching his firm and taking on his current role, Mr. Robinson worked for Governor Nathan Deal, Representative Phil Gingrey, and Representative Lynn Westmoreland. Also of interest, he began his career as a journalist at the Atlanta Journal and Constitution, and he continues to serve as a political commentator in Metro Atlanta's media outlets and national cable news channels, with weekly appearances, for instance, on WABE's Political Breakfast. So, as no stranger to the virtual interview or to the political process in general, please help me to welcome Brian Robinson as he gives us insights on how to lobby in a virtual world. And again, please stay muted, but feel free as Mr. Robinson is speaking to add comments and questions in the chat box. Mr. Robinson, welcome.
Thank you. Thank you. And Dr. Zertuche, you don't know me, but when Kate told me who was going to be moderating tonight, I was like, God, that's a very unique name. Sounds familiar. So I texted my wife, and sure enough, you delivered my daughter 4.5 years ago. And it obviously you don't remember me, but I remember you because you were there for one of the most important moments of my life. And it wasn't one of the most important for you, but for me it was. And you were filling in for Dr. Suarez, who couldn't make it there that morning. So thank you. You are very important to us in my household.
Well, you were so sweet. I'm tearing up over here.
Yeah. Well, when I saw the Z, I was like, golly Moses, I know it started with the Z. I am so glad to be with you guys, to be with all of you doctors who are serving Georgians every day. People who, when you poll people across the country, what professions do you respect the most? You guys are always there near the top of the ticket. I have spent my career in political communications. So I'm on the other end of the spectrum when it comes to people respecting what I do for a living. My mother used to tell people when she was asked, like, what did Brian do? She goes, well, I think he lies a lot. That's my own mom. So I can only imagine what the rest of the world thinks about us. I'm so glad y'all are here, because what that indicates to me is that y'all are ready to be involved. You're ready to be a part of this democratic process. And year in and year out, I've often come over to the Sloppy Floyd building and spoken to your group there on your legislative day and had this same conversation. And this year obviously is going to be a lot different. Dr. Zertuche mentioned last year where you had FaceTime with the governor of Georgia, the lieutenant governor, the speaker, the public health director, Kathleen Toomey. Those things, really are irreplaceable. I mean, that is so important to have that visual. And you guys have, of course, the incredible visual of showing up there with more than 200 doctors, all of you in your matching outfits, and you have an optical effect, and people know that you are there. And and going back to that respect, y'all are a group that legislators want to talk to. Y'all are people who have instant credibility with your legislators. And you have a story to tell, not only because a lot of you are actually small business people too, right? You're not just healthcare providers. Maybe you own your own practices. So you bring numerous perspectives to the table, from the business development to healthcare delivery, but also something we've talked about a lot over the last few years. I know we had a doctor from South Georgia speak just a little bit ago. Obviously, there's been tremendous focus over the last 10 years when it comes to rural healthcare and preserving it. Obviously, specialties like OBGYN, neurosurgeons, y'all know this better than I do. Obviously, there are many parts of the state that are just vast wastelands. I mean, you can't get to those specialties in any sort of reasonable time frame. And that is a crisis not only for Georgians who need it, not only for your profession, but also for economic development. I mean, businesses aren't going to go to a place where their employees can't get healthcare delivery. So you guys have many different angles with which you can approach your legislators and in our state's leaders. So virtual lobbying is kind of requiring a lot of the changes, the readjustments that we've seen really across industry around the country these last miserable 10 months. And it's in some ways got some benefits. You don't have to show up and spend an entire day away from your business and your patients to come to Atlanta and spend some time under the Gold Dome, unless of course you just think that's just the best way to spend the day and it's the most fun thing ever. And in many ways, you can still be just as effective, and maybe even more effective to some degree, in communicating with your legislators. And I want to pause here because I talked about giving some context to our General Assembly, because I think that's important when we think about approaching it, because it demystifies it to some degree. Our legislature is one of the biggest numbers wise in the entire country. We have 180 member House, which is the second largest House of the 50 states. Ironically, the biggest is New Hampshire, which has, the same size as Fulton County. And it's got 400 members, but they serve for a couple of days a year and they don't get paid. So it's a little bit different up there. But in the Senate, we have 56 members. And so those are much larger populations in each of those districts than there are in the House. So with 180, I think we now have 50, 60 something thousand people in a House district. That's going to go up. It's probably more than that now that we're at the end of the 10-year census cycle. And we'll get to that in a minute, because we got some really big stuff happening this year when the census numbers come in. But those small districts, while I think it makes the House too big and a little unwieldy, the benefit of it is it makes it very easy to have a relationship with your local representative. It's fairly small areas, and and look, they are more than willing to meet with you, to come to your business after the pandemic is over, but more than happy to talk with you. You'll find, and many of you I know do have tremendous and deep and long-lasting relationships with your legislators, but I highly encourage that. And just call them, reach out to them, set up a Zoom call. It's always great to do this in the virtual time. Now is a really good time, actually, to have those contacts with your legislators, because they're mainly in committee hearings right now. We have a 40-day legislative session. That doesn't mean like, it starts like the second Monday or something in January. It's not 40 consecutive days. It's just 40 days that they are in session. So theoretically, it could go through December if they really wanted it to, but nobody really wants that. But it generally lasts into late March or to mid-April, essentially. But they're not on the floor all day right now. They're in committee hearings. They have a little more flexibility. And right now is when they're doing the budget. Last week they had the budget week where they were in hearings all day long, and now the House just put out their amended budget, which is going to have some very important healthcare related items in that. And the amended budget, just to explain that, there are two budgets that they pass every year. The General Assembly only has to do one thing, only one, and that is pass a balanced budget. They don't have to do anything else. They don't have to do any bills about public safety or the courts or education. All they got to do is pass a budget, but they pass two. One, the fiscal year goes from July 1st till June 30th. So the first one that they do, the amended budget, changes the budget that we're in right now, the one that goes through June the 30th, 2021. And that one this year is particularly important because last summer, like all of you guys, we didn't know what was coming economically. We didn't know what was going to happen to revenues. And so the General Assembly came back in the summer and really tightened the belt, anticipating that our economy was going to suffer and that tax revenues would go down. It never materialized. And part of that's because of the stimulus that came from the federal government, put money into people's pockets, and consumption continued relatively normally, despite all the disruptions in our economy. So the good news is, and it's so great to have a little bit of good news because there's so little good news when it comes to the state of the nation and the state right now, is that they're adding money to this year's budget. And right now, a lot of that money is going toward backfilling cuts to education, which took a pretty big hit last year. And but there's also going to be some healthcare, and I don't know all of the details of what it means for you and your individual industries and professions and specialties, rather. But I do know that there is a concern about the impact that the pandemic has had on the healthcare profession. I know, for example, nursing homes, which is outside of y'all's purview, but obviously they're dealing with huge vacancies because people are scared putting their relatives there. And the extraordinarily high burden of cost that to administer tests twice a week under the new federal mandates, or however often it is, but it's a lot. And it's millions of dollars a pop when you do it across the state. And they're facing some of the same issues you are about trying to work on Medicaid reimbursement. So, talking about the size of the two houses, and we talked a little bit about the session when it begins, when it's a good time to speak with them and to reach out. Again, now's a really good time to do that. And we are in an interesting, to give you a little more background, we're in an interesting time in Georgia. And I'm happy, by the way, on the back end of this to take any questions about this topic, but also anything about the crazy politics going on in Georgia right now, because we are in this extraordinary situation. We are the focus of the nation for 2 months. And that's why we're coming home to getting 6 pieces of mail every day, and every TV commercial was about the Senate races. We are in an extraordinary and interesting time, and I think it's going to change some of the strategies long term for how we communicate with the General Assembly, because we will have some political change over this decade. And going from 2 Republican senators to 2 Democratic U.S. senators is one example of the way the state has become competitive, and how some of the priorities legislatively will change along with that sea change in our state's politics. So this year, a lot of the focus will be on stuff important to you. It'll be on healthcare. It'll be driven, of course, by the public health. The vaccine issue is going to be a big issue. And I think a lot of the stuff that dovetails with what y'all are saying will be of relevance. I think you're going to be top of mind in a way that is a rare opportunity, because there's such interest at this juncture. And of course, the stuff going on, the lack of infrastructure we have in our public health department, I think has brought some of these issues to the forefront in a way that is an opportunity to be exploited. It is an avenue for communication with your legislators. Looking at those things, there are numerous opportunities. One, again, reaching out to your legislators, getting on the phone with them, doing a Zoom call with them. And also, speaking of that amended budget and the bigger budget, this is something that we talk about a lot when y'all come to the Capitol. I always say, hey, when you get to the rope line and you put in a note to talk to your legislator, they come out to see you, snap a selfie with them, post it on your Facebook, your Twitter, your Instagram, and tag them so they know that you did it, and make some positive comment about them being accessible, about them listening to your concerns, about them caring about your patients, their constituents. That goes a long way with these guys. They don't run big, expensive campaigns like the 2 Senate races that we just saw. It's much more shoe leather campaigning, and having that sort of constituent affirmation is something that will stick out to them. It's something that will matter to them. They'll appreciate it, and they'll remember you as well. And so that is something that we can't do the selfies right now, but if they are voting either in committee or on the floor for stuff that's of import to you, praise them on social media, or write a letter to the editor, to your local publication, that talks about the importance of this, not only to your industry, but to your patients, to the people in that community. And then give that legislator credit and praise for supporting it. And then make sure that they see it, send it off to them. That sort of affirmation does make a difference. And, when it comes to their focus on campaigns, I also highly encourage you to be supporters of your local legislators, if you agree with them politically, if it's not, against your party, because they don't raise a lot of money. You don't have to give them a whole lot of money to make an impact. And it also gives you that face time with them when that day comes, that is so important in building those relationships. This year will be a very stressful year for them, because it is, as I mentioned, the census year. So in April, we'll get the census numbers, and they'll be coming back this summer to redraw the lines. And this is a terrible time for them, because some people are going to get drawn into other districts where they'll be facing other incumbents in next year's races. It'll force a lot of retirements, probably. Rural Georgia, particularly south of I-20, the districts are going to get much bigger geographically. In Metro Atlanta, the districts are going to get much smaller. And that is going to create an organic changeover in our General Assembly. It happens every 10 years. That's when you have the biggest amount of turnover, and it's built into the system. It's part of it. But many of them are fighting for their political lives this year. And so it is the worst. That's the worst, because it pits member against member, friend against friend, trying to make sure that you preserve your district that can get you elected and get you returned. But that'll be some of the fireworks that we will see later on this year. One thing about our legislature that is of particular importance, and this is a point that I make every year, is it's a part-time legislature. Like I said, they're there for 40 business days, and then they have some days for committee. But they all have jobs. They are doctors, they are lawyers, they are accountants, they are small business owners, teachers, and many of them either have the loss of revenue from the months that they are in session. Some, squeeze it all in and they go home and, but the lawyers I know go home and they do all their work, Friday through Sunday night. So they just kind of work 7 days a week. And they're not getting rich doing this. It really is truly a public service. They make less than $20,000 a year doing this, and they get like $100 something a day per diem. And so they serve on many different committees. They're torn in a lot of different ways. And I think when you first start going to the Capitol, what you realize, what is most distressing at first, is you assume, understandably, because it's so important to you and because it's so important to your community, that your legislators understand your issue. And they don't. They don't. You would be shocked if you polled members of the legislature at how few know the difference between Medicare and Medicaid. And you were talking about parity between the two, and that's hugely important. But many of them who aren't on those committees, who don't do this, every day that they're in session, do not understand your issues. And so there is an education portion. It is not just persuasion. It's not just getting them to see it from your perspective. It's telling them what it is, because there is a gap of information there. And because it's less than $20,000 a year, because it is a financial stress for many people who are in the General Assembly, our turnover in the General Assembly is extraordinarily high. And so we're constantly having to re-educate new members. And that's why I was bringing up redistricting, is because we're about to have a great big new bucket of new members that you guys are going to have to reach out to, get to know, and educate on these issues that are important to you. And how do you do that? What is the most effective way to tell them the story? And there's a temptation, and of course this is important, to just give them the numbers, right? And some of those numbers are important, particularly if you have a compelling story about how our Medicaid reimbursement rates, to use that example, are lacking when compared to neighboring states. Now, obviously we're going to be lower than your Californias and New Yorks and Illinois. Everybody knows that. How do we compare to Florida and Tennessee, South Carolina, Alabama, for example? And using those examples when we are not doing as well, when we're not getting the same reimbursement levels, and those kind of mega data numbers are very persuasive. They are very important. But beyond that, one of the most important ways to communicate that need is to tell a narrative, to tell a story. I know you have patient confidentialities. You can't tell names, but the stories of your patients, or the story of what comes through your doors, those are very powerful in bringing to life the way that legislation and policy impacts the people who vote for them in their communities. And harnessing those stories is something that has more impact than all the numbers in the world. For example, what I do now in my communications business is I do a lot of work on policy. And one of the things that I'm working on this session is something called educational savings accounts. And it allows parents to get the state funding for their child that goes to the public school, and empowers them to put their kid in a private school or get them a tutor, or put them in a pod, I guess, these days. And that story can become a really boring budget story. But if you tell the story of a single mother who goes to work every day and whose kids haven't been in school since last March. And there's no one there to make sure that they're doing their virtual learning. And I definitely perked up when I heard Dr. Willingham talked about the mental health aspect of what this has meant for children. You start telling that story, and all of a sudden, this boring budget story really has an emotional impact. I know you guys probably see stories that would bring people to tears every day. And there's a way to use that for good. And I'm not saying to exploit it. I'm saying there's a way to use it for good that can help you meet your policy ends. So with all that said, let me see if I'm missing anything from my notes. Oh, yes. One thing to keep in mind, as I mentioned, that they don't necessarily know your issues. One other big picture thing to consider is that your issue is important. I mean, it's of critical importance for all the stuff I said at the beginning. It's important for health. It's important for our economy. It's an important part of the small business infrastructure in our communities. And there's a temptation to be offended that you're not getting everything that you want in the budget, because what you're doing is important, and you know it's important, and they know it's important. But as I also mentioned, the number one thing they got to do is pass a balanced budget. That's it. And our budget in the state is $27 billion. And that has to cover basically everything. 50% of that budget goes to education. Right off the top, 50% is gone. Interestingly, though, number 2 is healthcare. So some legislators will say, look, you guys are already getting a big portion of the pie. Yes, it's important, but we've now gotten up to close to 75% of the budget. That leaves 25% for everything else, from our police to our prisons, to our court system, to our university system. All of that is, the university system, I'm sorry, is in the 50%, but there is tough competition, and all of those folks have a good story to tell for why they should get a bigger share of that pie. And just to give you an example of some of the stuff they're talking about this year for spending increases is the Department of Juvenile Justice, which is where they house, underage inmates. I don't know what you call them, but underage kids who are in detention. The people who the workers in the system who the guards, there was a 100% turnover rate last year in the employees, 100%, because they make less than $30,000 a year, and they can't keep anybody at those levels. And so that gives you an example of how there are serious needs out there. And of course, right now there's such a crunch already. There's going to be so many resources devoted to getting the vaccines out, and so much attention focused on that. I do wonder if one of the things that you're going to run into this year is, hey, I got, I'm health cared out. I'm health cared out. But that said, you have to keep telling. I think the vaccine is not the vaccine. The pandemic is a great vehicle for you, because it does and has brought to light the critical nature of our healthcare infrastructure and where we have lacked investment in perhaps throughout our entire history. So with that, I am happy to take any questions that you might have. I hope that you have some. We can do it on this topic, or we can do it on politics, whatever you want to talk about, but I'm here.
Great. Well, thank you, Mr. Robinson, for that excellent presentation. It's lovely to see you again.
I'm awake this time.
I certainly feel more knowledgeable and slightly more prepared to tackle this legislative session despite the raging pandemic. I would like to open it up for a brief question and answer session, and I think our staff have been eyeing the chat box and have gathered a few questions from there. Do you see the questions that they've sent over to you?
Yes.
Okay, great.
And I don't know exactly where to start. See here. what if my legislator calls me and asks my opinion on a bill, but I don't know if my association has a position? What do I do? Well, you call your lobbyists and ask them. That's the number one thing, because they will get you the talking points. And look, this is what I always tell politicians too, when I'm doing media training or communications training, is it's okay to say, I'll get back with you. It's better to say, I'll get back with you than it is to give the wrong answer. Because if you give that wrong answer to a legislator who is dealing with 50 different issues at once, that's what's going to stick in their head, right? It's going to be hard to claw that back and redo that. The important thing is to get back with them. That is hugely important. And on that, I would highly encourage you, because many of you have legislators as patients, or you delivered legislators' babies. You don't have to be like, hey, well, I got you here. I would like to talk to you about HR 117. I can see where that would be uncomfortable for everybody involved. But what you can do is say, here's my personal cell. If you have any issues or that come up where you need a healthcare perspective and want to know how this would impact our community, please call me. I would love to be part of that conversation. That way you're not pressuring them, you're becoming a resource to them. And perhaps if you don't know them well, building a relationship with them, because that relationship is critical. And you guys have fantastic government affairs team, right? Great lobbyists, and they've got a great network. They know the chairmen that have the biggest impact over your issues on the appropriations committee and in the healthcare subcommittees, healthcare committees. And they have the strategic know-how to get things done. And a lot of it is getting things done over time, particularly with budget items as big as the ones that y'all are talking about. I mean, y'all's items really are very big items. And if you do even incremental progress toward them, the budget balloon is significantly bigger than giving a raise to the Department of Juvenile Justice guards. And so that's one thing to keep into consideration. But as you're making that incremental progress, those relationships are critical. And your lobby team have great relationships, but you have a relationship that can be deeper in many cases, that can spread out the impact of your organizations, and even bring in people who perhaps don't deal with healthcare stuff at all in what they do in the General Assembly. And if they don't know much about it, they may be easier to convince that to be on your side, but be a resource. I think that's a great place to start. Somebody asked, Joanna asked, how would you suggest somebody who has never done this before get started? I'm new to this and overwhelmed as to where to start. That's kind of how I feel about getting the vaccine. I just feel overwhelmed by the whole dang thing. I don't, what do you do? I think that the place to start is by reaching out and starting a relationship with your legislator. It's as easy as that. We're talking about doing it in a virtual world, and so you can do it over Zoom, you can do it over a call, you can do it in your community. When they're back home, because they do live there. They're not. It's not like they don't go to Washington. They live in your town. Get to know them, because that will pay dividends. That's where I would start. And being part of this group, and when the time comes and we resume and you can go back to the Capitol, coming to a day like that will give you a lot of context for what's going on, and you'll see sort of the chaos of the Capitol, and it'll bring to life what I'm talking about as far as they're on all these different committees, they're being pulled in 1,000 different directions, and it's a new issue every day. And you'll also begin to understand why they're not experts on every single issue that comes up. Kate asked, what is the best way to draft a written correspondence to a legislator to engage them to take action on an issue? How best to frame the message?
No, don't do it.
That is actually a great question because it's tricky. And right now, written correspondence would get lost in a sea, whether it's in a letter or an email. And that's why that relationship I was talking about is so important. If they see your name in the inbox, maybe they're going to click on that because they know who you are and you develop this give and take. But I was talking to many legislators in the November-December period. And at the time, and this is extraordinary, but interesting, the president of the United States was saying that the election in Georgia was stolen, and was saying, why aren't you doing something about this? And the legislators were literally getting 1,000 to 2,000 emails a day from people emailing them saying, why aren't you doing something? And that was overwhelming. And there was nobody who was going to email them who's going to break through that noise of that moment. And there's going to be that noise that's not going to be at that level, hopefully, but for the love of God, don't let it be at that level for too much longer. But there's going to be a lot of chaos and noise during the General Assembly session, a lot of people tearing at them. And that's why when it comes to correspondence and to the relationship, doing it after the session, doing it that May to December period is hugely important when it comes to their relationship building, because they're not going 1,000 miles a minute. Some of them will have campaigns next year, will be consumed by that. But for the most part, most of our legislators, once they get there, don't really face a lot of competition. They basically can stay for as long as they want for the most part. We only had like 2 or 3 people lose their seats in the last cycle. So most of them do have the time, and that is the time to get them. Cyril asks, how can I influence redistricting or understand the process? The process is utterly remarkable. And I've been very involved with this through the years. I was in Governor Deal's office in 2011 when we did it the last time. And there was, a little bit of political score settling. We'll tell you one quick funny story. Well, it's not so funny, but, in the 6th congressional district in the northern arc of Atlanta, it was represented at the time by Tom Price, a doctor and a good guy, went on to be HHS secretary, of course. Well, Dr. Price had endorsed Nathan Deal's opponent in the primary. And so as a result of that, the 6th district was changed dramatically in redistricting, and it went well over into DeKalb County, which is a Democratic area that's gotten more Democratic since. And as a result of that seat is now held by Democrat Congresswoman Lucy McBath. And that all goes back to 2011 because there was a score settled about something that had nothing to do with policy or legislation. So there's a lot of that. So you have any troublemaker legislators, people who don't play by the rules or who cause a headache for leadership, they're going to perhaps be drawn in with somebody who can beat them, or have the district moved away from their population base, that kind of thing. So you can't take the politics out of politics, and there's no political machination more political than redistricting. How can you be involved? It's really nearly impossible. And it's going to be particularly tricky, this year, because Republicans control the redistricting process because they control both the House and the Senate. But the areas that are going to get smaller are in areas that are heavily Democrat, and the areas that are going to get bigger are heavily Republican. So there's no way to redraw it without creating more Democrat districts. There's just no way to do it. So that's going to be a really interesting thing to watch. Jennifer tells me to get the vaccine, and if somebody here has the influence to get me on the A1 or 1A list, please email me or text me. I would love to do it. And I will. Mary Daniels, I know you. Yes, I will talk to my primary care physician about the vaccine.
Mr. Robinson, why don't we take one more question, and then I hate to have to wrap it up, but we are approaching our 7:30
Yes,
deadline.
ma'am. You read one for me.
I don't know if I have all the ones that were sent to you. There was one question from Dr. Doyne. Do you really believe there will be movement on Medicaid with the current governor and General Assembly?
Thank you for bringing us back to Medicaid, because going back to the incremental progress that we were talking about earlier and how important that is when you guys are such a big budget item and how a minor change has huge impact. The journey of 1,000 miles begins with one step, right? And I just mentioned Mary Daniels. I worked with Mary Daniels and a few others of you back in 2016 on the Medicaid waiver program, trying to build support for that. I was disappointed because, you know, Governor Deal just wasn't that interested in it. And of course, he's my old boss and I love him dearly. We were never able to make that progress to take advantage of what Obamacare offers and to expand the net and to reduce the level of uncompensated care. Fast forward a few years, and Governor Kemp did make that a priority. And we are going to be adding 50,000 more people to the Medicaid rolls, people who would probably be in the uncompensated care category. If not, but one thing I'll say about the Medicaid expansion issue is that incremental progress was an important part of the politics. There's been this institutional resistance to Obamacare amongst Republicans, but that has begun to change. And, you know, really ever since President Obama left office, it's harder to attach it to him. And more Republican states have expanded Medicaid. I can promise you this. I have no doubt if Obamacare and Medicaid expansion stay in place as they are, we will have full expansion in Georgia this decade. That will come at some juncture. And again, we're going to have a more Democratic legislature after next year. That's going to be part of this. And a lot of Republicans support it too. And at some juncture, that 90-1 match becomes too good to turn down. And I admire Governor Kemp for trying to get this done. But I think even he would acknowledge that, you know, the state is still spending a lot of money. We're not covering nearly as many people as we would under a full Medicaid expansion by maybe 10 times different. But we're paying the old FMAP rate. So we're paying, you know, 30 something dollars out of every 100 instead of $10 out of every $100. So there's going to be tremendous pressure to move in your direction in the coming years. Again, incremental progress, but it's coming.
Well, great. Thank you so much again, Mr. Robinson, for your answers to all of our questions and for your excellent presentation in general. What a great session. FYI, for those that are interested, tonight's session was recorded and it will be emailed out to all the participants later this evening. To close, I would just like to express our sincere gratitude for all of the PC Squared leadership and staff that helped to plan, arrange, and facilitate tonight's event. It's certainly, you know, an interesting endeavor in a crazy world in which we live. Particularly, I'd like to say thank you to our Georgia OBGYN Society Executive Director, Kate Boyenga. And finally, thanks to all of you, our participants, for taking the time out of your busy schedules to be a part of our first PC Squared legislative webinar. We hope that you can take what you learned today and implement those tools during our next 2 virtual events with real live legislators. So on that note, please remember to mark your calendars to return to this virtual Zoom room to meet with the members of the House of Representatives on February 10th at 1 p.m. and to meet with members of the Senate on February 25th at 1 p.m. In the interim, do not hesitate to reach out to your own professional organization's leaders with any feedback on tonight's event or with any questions about moving forward. And that concludes this evening's program. Thank you, everyone, so very much, and good night.
Thank you.